Thank you everyone for joining. I'm Andy Dwyer from University of Colorado Cancer Center in the Colorado School of Public Health. I'm very excited today that Elsa Welstein and myself have Caren Bacon as well as Kim Prewitt from the Center for Public Health System Science at WashU joining us today as we are sharing a little bit further about the idea and really thinking about how do we talk about sustainability in a very dedicated approach, thinking about the implementation and what does this mean for our programs, our partners, and really thinking about something tangible to move ahead as we really think about maintenance of programs, sustainability of programs beyond oftentimes our grant and foundation dollars. But even for many of the types of evidence-based interventions that do have reimbursable funding and are, have basically, sustained on most levels, that it's not just about getting it implemented and ready and sustaining, it's about really that maintenance as well. So we're really excited. We're hosting this webinar today because in our work at University of Colorado, we've had a lot of questions about for our programmatic work and as with our national partners as we've been considering navigation approaches, how do we think about sustainability? And so we chatted with Caren and Kim and said that, of course, because we really focused a lot of our work on their frameworks, I think it would be helpful to hear a little bit about the work of WashU and then at the University of Colorado with our area of focus around navigation. How did we really adapt to think about sustainability? So today we'll be really focused on the and the development of the tools and how we've been thinking about the implementation and what does sustainability mean, the design of some of the work we're doing, and then we'll host a second webinar that will talk about the outcomes. And again, I hope this is helpful for many that we've worked with. We've shared our approaches who wanted to learn a little bit more and dig in. So with that, we'll have Caren and Kim share today, have an opportunity for them to introduce themselves, as well as Elsa will have a chance to further introduce as well. So again, if you're just joining us, thank you. Let Erin know if you have any specific tech issues. We'll go ahead and be using the chat today. If you have questions real time, please feel to add that in and we'll try to entertain questions as we go. But we'll of course open time at the end for people to come off of mute if you'd like. And I do want to also just say Erin Martinez is joining us from PNTC. We have been doing a lot of work around sustainability and thinking about workforce development through the Patient Navigator Training Collaborative. So we may be sharing some upcoming offerings as well. So with that, I'm going to turn it over to the lovely and talented Caren from WashU. And Caren, we'd love for you guys to kick us off today.
Great. Thank you so much, Andy. As always, you're so kind in your introduction for us. And now I'll just give a quick little background on who I am. I am the manager of evaluation at the Center for Public Health System Science at WashU, and I'm a facilitator for the program sustainability assessment tool and the trainings that we offer with that. Kim, did you want to say anything really quick before we jumped in?
Sure. Thanks, Caren. Hi, everybody. Thanks so much for having us today. I manage the sustainability projects at the Center for Public Health System Science. So I'm just excited about the work that we've done so far with Andy and excited to be able to talk with you all today as well. And get started.
Great. Well, let's go ahead and jump in. So today we have three primary goals for our talk. We're going to define both program and clinical sustainability and talk about the differences between these two terms. And then we'll go on to explore the factors that influence sustainability capacity by reviewing both the program sustainability framework and the clinical sustainability framework. And then last, we'll wrap with our discussion by talking about Annie and her teams and their development and adaptations. So next slide. So first off, why is sustainability important? Without sustaining effective programs and practices over time, we risk not being able to see that full return on our investments in public health and clinical care. This is important because sustainable implementation helps maximize the benefits of evidence-based programs, and also lots of time and resources go into implementation. And if that is lost, if interventions are not sustained, we all want our programs to continue, and we hope that those benefits will be sustained, and that takes active focus and planning. Next slide, Kim. So sustaining, there's changes and there's challenges, and especially since things don't always go as planned, right? This may look like adapting your services to a crisis, such as a pandemic like we're currently in, or it may be much more routine, the things we're used to, adjusting to things such as changes in funding. So before we dive in and really start talking about the program sustainability framework, I wanted to give you a little bit of background information about how we came to view sustainability the way that we do. Our work came about through a partnership with CDC. After funding cuts came through, CDC wanted to better understand the factors that contributed to the sustainability of the state tobacco control programs, and they commissioned our research center to investigate this. So since 2010, our team has developed, refined, and distributed our sustainability framework and supporting materials. We've had the opportunity to work with public health and social service programs across the country, from community organizations to national groups, each with their own unique challenges and resources to draw from. And it's important to note that although our roots are in tobacco control, the scope of our work has really expanded, and we work with diverse public health, clinical care, and social service programs. Next slide. Thanks. So as you can see, this is what we call the D&I pipeline. So dissemination, implementation, how we go from scientific discovery to public health impact. And while much work has been conducted in the fields of DNA science, there has been less focus on the area of sustainability, which is an important part of the process of translating research into tangible public health benefits. If you click again, Kim, this little red box here kind of highlights where sustainability is at in that DNA pipeline. So often the focus on discovering what's new, but it's important to also understand how to continue these services and activities we know provide benefits to our community, not just focusing on the new things. Next slide. So after an extensive lit review process, concept mapping, expert input, and reliability testing, we developed a program sustainability framework, and a 40 question assessment tool was then built off of that framework. And we call that the PSAT, or the Program Sustainability Assessment Tool. The goal of this framework is really to help demystify sustainability by identifying 8 organizational and contextual domains so that can help people focus on the capacity for maintaining a program. So programs can be proactive about building sustainability by focusing on strengthening those domains. Next slide. So this framework for program sustainability has been completed over 9,000 times since the website was launched in 2014. It's been used both nationally and internationally with a variety of programs. So that was just a really quick highlight on the PSAT and the program sustainability framework. And now I'm going to hand it over to Kim, and she's going to introduce the clinical sustainability.
Thanks, Karen. I'm getting ahead of myself. So while the PSAT was being used to assess clinical care and behavioral health programs, we were getting feedback that some of those, the participants, that the terms that the PSAT use might be common language in public health, but they don't always translate well to clinical care. And that's because there are some key differences in comparison to public health programming. So clinical practices are more reliant on clinical and frontline staff, less reliant on external stakeholders. They're integrated with other clinical practice activities, more reliant on things like technical supports, and positive outcomes usually are more immediately apparent in clinical care. So in response to that need for a clinical specific tool, we developed a new sustainability framework and assessment tool that's focused on the specific challenges of sustaining evidence-based practices in clinical settings. And the development process was similar to that of the PSAT. So we did a literature review, concept mapping, and used expert input. And through that process, we came to define clinical sustainability capacity as the ability of an organization to maintain structured clinical care practices over time and to evolve and adapt these practices in response to new information. So about this time is when we started working with Andy. And so she was there as we were starting to develop this work. And she got to kind of see, the changes that we were making. And while she could see some benefits from both of the tools, neither was exactly a perfect fit. So that is how she started working to develop a tool that was a better fit for CCSP. But I'm going to share a little bit more about, the development of these tools. So, looking at these two, this is sort of the domains from each one of those tools. And while you do see some overlap, they really do address different, the domains really are a little bit different as well. And so if anybody is interested, these are both available on our website. And if you're looking for trying to decide between which might be a better fit for your program, both of the assessments can be viewed online ahead of time, and you can see the questions to do a test or see what might be the best fit for a program that you would like to assess. But how did we build these? So like I said, the development process was similar for both the PSAT and the CSAT. But I'm going to talk a little bit about the CSAT as the example. So initially, there was a review of the literature and of any existing sustainability frameworks. Next, there was concept mapping, and we drafted an instrument and piloted it. And then after, the psychometric analysis, made some updates, and then ended up with the tool that we have today. So that first piece, the concept mapping, we started out by asking experts in clinical care, behavioral health, and implementation science to list things that they thought contributed to sustainability of a practice in clinical care. And then they sorted those items, and you can kind of see how they map out in this concept mapping piece and how similar this is to really the framework that was developed. Next, those domains were rated by importance and feasibility. And then, like I said, we compiled those items into the tool and we piloted it. So it had good reliability for the 5 items in each scale, and confirmatory factor analysis showed support for 7 distinct constructs in that framework and tool. So the tools have shown to be reliable and valid, but they can also really help inform a program or practices sustainability planning. So I'll quickly introduce you to the planning process that we use for both the PSAT and the CSAT when we're working with programs that want to build their sustainability capacity. The process is three easy steps. The first step is to build your understanding of those factors that impact sustainability by really reviewing the frameworks, the domains, and familiarizing yourself with sustainability and those constructs. The second step is to assess your program's sustainability capacity by completing either the PSAT or the CSAT. And then that final step that we haven't really talked about yet is to use the assessment results to create a sustainability action plan. We like it to be focused on increasing capacity for sustainability in one chosen domain. We don't have enough time to walk through the entire action planning process today. And really, your approach may look different from ours, but maybe some of these key takeaways might be useful when you're thinking about sustainability for your program. So it's helpful to think about which domains you have the most control over improving. This is from the PSAT framework, but it's really important to think about where you can kind of move the needle. And sometimes those gray environmental support and funding stability might be more challenging to impact when you're first starting to think about building sustainability capacity. And so you want to look to those other blue domains and think about where you could focus your efforts that might end up having an impact in other domains down the road. Like I said, all of the domains are connected, and that really means that working in one domain should have a spillover effect and should impact the other domains that are in the framework as well, sort of increasing your sustainability capacity for more than one domain. So when you are ready to develop a plan, like I said, the first step is to think about the domain that you want to focus on. And then that focus can guide the development of a SMART objective. And you're probably familiar with the idea of creating SMART objectives. You want it to be specific, measurable, attainable, relevant, and time specific. But that objective can then guide your plan and make it actionable. So you'll break it down further into steps that you're going to take to reach that objective. For each step, you'll want to include specific notes about who's responsible for seeing that work gets done, any resources that are needed for that step, and definitely a due date to keep you on track. So this is just a sample plan that our team developed, but it gives an idea of how a completed plan might look. It's important to know the level of detail here, not necessarily what we included on this image, but just the fact that each step also has bullets or sub-steps. So there's just a lot of detail here. We hope that plans are written so that anyone can pick it up, understand it, see how much has been completed and where they can start working. We have other action planning examples and other templates on our website as well. But we definitely know that there's not just one approach to developing a plan for sustainability. Okay, so a little more about some of the current work we're doing and the direction that we're moving in. We are continuing to collect sustainability data through folks that use the website, but also there's some other specific projects that we have going on right now. We are working to make the tools more accessible by translating them into other languages. And then based on feedback about length, we're considering short versions of the tool. And this is kind of looking promising so far. So for translating the tool through a partnership with St. Jude, both the PSAT and the CSAT have been translated into Spanish, and the CSAT has also been translated into Portuguese. We're also working with another group to possibly have French versions of the tools available soon. So these are all available on the website as well. And then the short version, we're really had some concerns from folks about the amount of time that it takes to complete the assessment. And some folks thought, 12 minutes was too long. So we're looking to see it about cutting it down. What we found so far is that, at least for the CSAT, going from 5 items per domain down to 3 really is still a reliable tool. So right now, that's kind of the next thing that we're working on testing out for both tools. So we make these changes because we recognize that, even though the tools that we developed are widely used, they may not be a perfect fit for sustaining the work that you do. And we do encourage the adaptation of the tools like Andy has done as she developed the PNSAT. And they're going to share more about that with you today. Some other work that we're doing right now as far as adapting the tools, we're working with the Rocky Mountain Tribal Leaders Council to adapt the tool for an American Indian group that wants to use it to help sustain their commercial tobacco prevention efforts. And we're also collaborating with Salud Mesoamerica and their initiative. They're working to adapt the tool for some of the international work that they're involved in as well. So I'm just throwing this up here for now, but I'm sure we can come back to it again. If there are any questions in the future, you can always feel free to reach out to me or Karen, or you can contact us through the website, sustaintool.org. I'm going to stop sharing and pass things back to Andy and Elsa.
Great. And I just want to say, Kim and Karen, it's just been a pleasure. I think when we did check in, I think the beauty of working with you all to talk about this tool is I didn't get a sense at all of, yes, ownership, but ownership that was collaborative and saying that on some level, these were your lessons learned. This is the area that you were adapting, and you really brought us in understanding that PNSAT and the CSAT. And when we're thinking about like a public health approach that has clinical implications, really guiding us. So, I know that you guys don't need a ton of new business, but I would just say that on really that having consult with you and talk through this, it was a very collaborative process where the Sustain tool was about disseminating it and thinking about how to best fit based on the evidence and the modeling you've done, but how to adapt that. And I think you guys' sense of really being collaborative and really sharing the information has just been a breath of fresh air. So we're going to talk a little bit about how we did adapt this work, giving a bit of framing. Elsa's going to go through really how we did line up the PNSAT, CSAT, and the new tool and some of the implementation of that work. But I just want to say, ladies, at the even beginning of this presentation, we really were in the market for something to think through how we would move this forward. Betsy Risendahl, myself, and others had been thinking this through and had used some of those constructs. So having you work with us to really develop this has been great. And we didn't have to create it from scratch, and there was already good evidence. So win-win. So also we'll go ahead and get ready to talk a little bit into the next slide. Ultimately, our objectives today are going to talk about how we have adapted for the Colorado Cancer Screening Program with an emphasis on navigation. We're going to talk about the purpose and background of how we've engaged our program partners in the navigation and sustainability process, and talk about the overview of that adapted approach. And then we'll talk a little bit about some of the other initiatives this has informed. Part 2 will be mid-January. We will be talking about the application and outcomes of the sustainability tools and process. So today, again, is really talking about that formulaic. How did we develop it? What did it come from? And how did we implement? So that's what we're achieving today, again, based off the great foundation from WashU. So for those of you who are joining in, the Colorado Cancer Screening Program, CCSP for Patient Navigation, we're a statewide program that partners with safety net hospitals and primary care clinics all throughout the state to implement and support patient navigation for the medically underserved, specifically looking at cancer prevention. Most of the work we've been working towards has been colorectal cancer based since about 2007 with our funding from our state partners, the CCPD grants program through our state health department. But we've grown that initiative to also include looking at risk of family history, using evidence-based strategies for lung cancer, also really looking at stool-based screening and hereditary cancers again. We're really looking at our current cycle in terms of looking at growing the capacity for other types of screening type programs based on our lessons learned in colorectal cancer. But again, a lot of our focus has really been thinking about program implementation of that navigation centric type of approach, and how do we continue to work with our statewide programs and partners for implementation and really sustaining that navigation aspect. So next slide. So for our purposes of CCSP planning, that we know that, of course, evidence that patient navigation is an evidence-based strategy and approach. When we're thinking about barrier reduction, access to care, thinking of health equity, it is really one of the only strategies that's shown to increase equity and decrease barriers. We do receive that grant support for ultimately implementing this to continue this work. But we're really thinking about how are we moving on grant support now that we know that we have great outcomes, evidence-based is established, and how do we build this business case, in this case, for building that capacity and moving this work going forward. So ultimately, we looked at a dedicated approach of how are we sustaining our navigation work and our CCSP evidence-based interventions towards increasing cancer screening. And ultimately exploring what we can do for paying for this work, but also how we're going to truly sustain the work in kind of a maintenance mode, even if we do look at grant type support, or support other than grant type funding moving forward. And so that was really part of our initiative set forth. Next slide. So ultimately, we engaged in looking at a sustainability process working with WashU. We had developed a number of types of tools and strategies in terms of developing a process. Ultimately, we started working with the American Cancer Society and partners in developing a paying for colorectal cancer screening navigation toolkit. But what was interesting at the time as well, I was talking to ACS and partners about sustainability, just saying it's not about ultimately about just paying for the work. It's ultimately also looking about how do we create other types of strategy that once it is funded, once there are big policy initiatives, how do we really keep that in place and continuing to champion the cause? So this really helped us really think a little bit about our strategy for our program in Colorado. We developed a toolkit, and then again, as I was starting to make this relationship with WashU, started to think about sustainability in a bigger way. That toolkit is developed through ACS, the National Navigation or Colorectal Roundtable, and we've been doing some extensive work, information shared on the CCSP website as well as ACS site. But we also began to develop case studies thinking about how do we build that capacity for sustainability in Colorado based on the work that we'd already started to implement and started to design and develop working with WashU. So next slide. And so ultimately, when we developed this partnership with WashU, we started to begin by really thinking about the PSAT tool and working with a subset of our clinics within CCSP. When we started working, and as Kim and Karen alluded, we did get that feedback that although it was for a public health intervention, that there really needed to be that consideration of the clinical landscape as well. We had a number of phone calls to say, we love what you've done with the PSAT. Can we really think about how we adapt this for our program? And again, getting that sort of passport to say, yes, let's work to develop these program or this type of approach and thing might work best for you. How do you design those clinical tools as well as those questions was really super amazing. And we're going to talk about how we built that together. And then ultimately working with WashU, we continue the support for implementing and getting that technical assistance about what we were learning from the field. So we're going to talk a little bit, and Elsa's going to go through those constructs and really what we developed for our program moving forward. But again, as you can see, it was a very iterative approach when we were really considering what did we know from our program partners, what did we know from our national partners about navigation, and how were we considering this? And I think one of the things, to kind of harken back to what I mentioned before, knowing that there had already been work in the field and not recreating that was something that I'm so glad we took the time to really evaluate and consider how could we build on and adapt with a partnership moving ahead. So next slide. And I'm going to turn it over to you, Elsa, to talk a little bit about where we went from this partnerships once we were ready to move forward.
Thanks, Andy. So back in 2018, when we were getting going with WashU, that is also the time when I joined the CCSP team as the program coordinator and now as the program manager. And so at this time, we had those case studies built as well as that toolkit that was really focused on that payment mechanism, but really wanted each clinic system to think about what they needed to do on an individual level, what was already working well, what were some of those barriers for sustainability across these several different domains, not just funding. So first, what we did is piloted both the PSAT and the CSAT individually with 3 clinic systems, as well as 3 to 4 partners from other programs in the cancer prevention and navigation space to see what they thought worked well and might not fit, because we had already gotten some feedback from others who had taken these assessments that they were close and really helpful in concept, but some of the domains and indicators didn't quite fit that clinical space and patient navigation programs on their own. So looking at both the PSAT and the CSAT, we incorporated that feedback on what was challenging and what worked well in concept from these tools, as well as working with WashU for their information on best practices and lessons learned. And so from that, we took many of the concepts from that CSAT, the clinical sustainability assessment tool that was currently being piloted by WashU, but really felt like it was important to maintain that funding stability domain, as well as pieces from the communication domain for our program. And also we heard from our program partners that stakeholders were a difficult concept for them, and working with external partnerships because many of the things that they needed to support capacity was great communication and teams working together within the larger clinic system and the several sites. So that led us to go through each one of the domains from the PSAT and the CSAT and transfer many of them over to the PNSAT, with an emphasis on the domains from the CSAT, but also incorporating pieces from the funding stability domain and that communication domain, and also needing to adjust language in a couple of places for our PNSAT. And just to note that this was the pilot version of WashU's CSAT. So as Kim presented on, they now have their final version of the CSAT, and there are some adjustments following when we were going through this adaptation process. So our final version of the PNSAT has 8 domains. So engaged staff and leadership, organizational context and capacity, that funding stability piece maintained from the PSAT, engaged community. So looking at both that external support and engagement beyond the clinical navigation team, but really including patients as well as other types of stakeholders. Communication, planning, and implementation, workflow integration, monitoring and evaluation, and outcomes and effectiveness. So looking at what those pieces were both in that clinic system as well as outside of the clinic system that help support sustainability in terms of workflows, how the process is being implemented, how it's being monitored and evaluation, and what champions and different pieces in that organization really need to be working well in order for capacity to be maintained. And so different clinics will have different strengths and challenges across all of these domains. And we really wanted to explore that individually with each of the clinic systems participating in CCSP. So the tool ultimately was called the Patient Navigation Sustainability Assessment Tool for Cancer Screening and Patient Navigation. We framed it to clinics as focused on patient navigation for preventive cancer screening, including their work with CCSP, but not only limited to that, as many clinic systems are also utilizing patient navigators for other cancer screenings as well as other chronic disease work. And we don't want to limit patient navigation scope within a vacuum, and knowing that it's important to look at patient navigation in a holistic sense and not just focused on individual body parts or practices. And so each of the 8 domains has 6 to 8 statements that were rated on a numerical scale from 1 to 7, with 1 being from to little or no extent and 7 being to a very great extent. And then we also added a couple of guiding questions for each domain that were adapted from work from the University of Michigan and were designed to enrich the responses to the indicators within the domain, and that would assist the clinic systems and the CCSP team in their conversations to think about what would be needed to focus on for a sustainability plan that would be actionable, and identifying training and technical assistance needs. And so our assessment took clinic teams about 15 to 20 minutes to complete, and it is available through Google Forms. The link is included in these slides, which we will send out to everyone. And so we did also frame this that even though we were focused on the preventive cancer screening work, we did want to allow clinics, if they wanted to use it individually for their other practices, to take the PNSAT as they're looking at other work that's not just involved with CCSP. So we followed the basic approach that was used by the Washington University team and their guidance to develop our specific sustainability planning process that we went through with each of the clinics participating in CCSP. And that was for 3 to 5 individuals who constituted the sustainability planning team to each complete the PNSAT from their individual perspective of their role. And so they each received an individual score report, and they automatically got that sent to them with a copy of all of their responses. What were those domains with the highest scores, the lowest scores, and then their responses to those guiding questions as well. And then we took all of that information to compile an averaged score report for the full team that we could send to them and then use in a discussion. And after all of the sustainability planning team members each took the PNSAT, we facilitated a discussion with them to discuss those results. What were those successes and some of the challenges and barriers they were experiencing within each one of those domains, and thinking about that, what were 1 or 2 priority areas that they could focus on to set an actionable sustainability goal that could be achievable in the next year to year and a half while we still have this grant funding. And so that included a SMART goal, but also what were those actionable steps that would be needed to reach that goal, what resources would be needed, and who they would need to involve as stakeholders, both from within their clinic team as well as support from CCSP and other external partners. And so then we provided regular technical assistance, training, and support based on what their goal was that they focused on, really with that emphasis on this is an iterative process. After a year with working on their individual goal, that they would have the opportunity to come back and make adjustments as need be. And that ended up being really important with COVID hitting about a year into the process. So this is just an example of what that score report looked like for us. It was very similar to WashU's framework with their overall score on an average of that 1 to 7 scale. The average scores for each of those domains, so they could see those that might have a lower score and those with those really high scores, and then a few pieces about how to interpret the results, but really emphasizing that these reports were just the starting point, and the individual scores, especially because some of them might be very close to one another, weren't as important as looking at some of those key pieces within each of those domains, and this was just a conversation starter. So when thinking about who to involve in a sustainability planning team, it's important to have a variety of roles that really are involved in your practice for whichever program or practice you're focusing on, in this case, patient navigation for cancer screening. So the clinic sustainability teams included patient navigators, their supervisors, a provider or other clinical champion, that leadership level for both clinical operations and financial leadership, as well as it was often very helpful to include those quality improvement team members. And trying to have some good variety. So it's okay if there's maybe 2 patient navigators or 2 people in a similar role, but really trying to have as much diversity as possible so that people are bringing their individual perspectives. And in these discussions, many people were not aware of some of the challenges that were going on in specific roles, and it was really helpful for that clinic communication. And so even though some members didn't have all of the answers or weren't fully informed when completing the PNSAT for a couple of the domains or indicators, bringing that knowledge from all perspectives was really important. And then some of the big pieces for developing a sustainability goal was thinking about what is an actionable planning goal that they can really achieve. And so sometimes what has that lowest score for a domain might not be actionable to focus on. And some of those that are in those mid scores might be more realistic to focus on for a sustainability plan at this time. So really what's achievable. And then thinking about what activities really need to be considered to reach that sustainability goal. So these are some really helpful lessons learned if your clinic system is starting to think, or program is starting to think about how to work towards sustainability and using an assessment. So we wanted to leave you all with some resources, and knowing that we'll be going into part 2 to share a little bit more about our results and those outcomes and lessons learned in part 2. But we have a sustainability planning Google site available that has all of the information about the PNSAT, those action planning tools, and some other resources and worksheets that have been helpful for clinic systems as they're developing and implementing their sustainability planning goal. I've also linked that Paying for Colorectal Cancer Screening Navigation Toolkit that's really thinking about that payment part of sustainability, and then more information about CCSP, and many of the resources and webinars, programming, tools, and resources for people working on cancer screening are available on our website. So I'm going to turn it back over to Andy to close us out as we're thinking about part 2 and looking forward in our work with CCSP, as this is still an ongoing process.
Great. So we will be spending some time talking about what we learned from our clinic systems. One of the things I want to say when we move into the work on January 11th, I think is also noted, the assessments and the work were really team-based. But what's interesting is I think from the cadre of clinic systems that we worked with, I think we were also able to see where we were in terms of working with safety net clinics, what people were prioritizing, different types of approaches and strategies that I think, we could say something holistically about what's happening in our state, which I think will then also be helpful and has been helpful in terms of thinking about the direction we're going for looking about sustainability, I think globally within Colorado. What I would also say is even with some of the work with the National Navigation Roundtable, with some of our other program partners, this information I think has been helpful. And it's the information that's bubbled up, but I think also having a framework like this has been helpful. I know even with the National Navigation Roundtable, we've been really thinking about how we think about partnerships and programmatic work and who's doing certain efforts to help sustain workforce, technical assistance, communication, but where do we really need to have some global umbrella work in terms of certain things like policy, different types of strategies to think about national reimbursement methodology, what have you. So what I would say is, as we're getting ready to talk about these results, I think the information has been very helpful for our clinic systems to think about where they are. I know they've used that process to think through QI, help meet some of their measures, thinking about where they're going for direction and how they're sustaining the work. It's been helpful at the state level, but I think even the information that's coming out in terms of the framework has really been helpful for us in our thinking about where are we going with this movement as we're thinking about sustainable strategies for navigation that have remained elusive at the state and national level. So here's a spoiler alert, funding stability was not the primary domain targeted for change. So this is interesting when we talk about CCSP. And again, I go back to even our role with talking about development of the sustainability toolkit with the National Navigation Roundtable, which is almost 5 years ago, to say it wasn't all about funding. And I think that even our clinic systems had identified some areas that needed to do in addition or complement that even were prioritized even above talking about sustainable funding. So there's some information and interesting things that are coming out of this process, again, that are really informing our work. And we're really thinking at, again, the program, the clinic level, but even thinking at the state and national level, what does this do in terms of this process? So thank you guys so much for the time. We have about 10-15 minutes for some discussion and questions. I know Kim and Karen are here. And I want to thank you immensely. If you have questions about the development of these tools, the process, anything you've heard today, of course, this is part 1, part 2 will happen. And if you need access to resources, Kim, Karen, Elsa, and myself are available. We'd love for you that if you have a question or comment, put it in the chat. If you're interested in coming off mute, just let us know so we can call in folks who might have questions. I want to thank you all for your time. But Kim and Karen, I think I'm going to start us off with one of the questions that I'm getting routinely. Ultimately, one of the questions that I've been asked is, as we have adapted our tool off of your tools, and people then even want to look at our tool to maybe even adapt for their navigation needs. And then I think this is probably true for other work that you've done. What is our process? What is our thinking about that? Do people need to ask permission? Should we all work together? I guess that's one of the questions that's coming forward in terms of just a process. So Washi ladies, I'd love to start with you, and I'll share some information that we've grown in terms of the opportunity. So Kim, Karen.
Yeah, I mean, I'll take a stab, but thanks, Andy. I think the thing that I feel like is most important when you're thinking about making an adaptation to the tool is sort of what I heard you and Elsa both say, that it is an iterative process. Like we didn't just look at it and decide, yep, these are the changes we want to make. That's going to be perfect. I'm sure it's going to be great. It was really like talking through and thinking about like, why we need to make these changes and what's the best way, and then sort of testing things out and making sure that they really work. But as far as the ability to make changes to it, yes, the PSAT and the CSAT are free and available on our website, and we put them out there for people to use. We want people to use them, and recognize that they may not be a perfect fit. So you are welcome to make changes. The only thing that we ask is if you'll cite us as the original tool developer, and that you'll share your tool as well. So like we're sharing it for free because we want people to use it. We want anything that gets developed from it to be shared and accessible also.
Mm-hmm. Great. Well, and I can say, I think the ACS Global team, and this was actually quite cathartic and it was fantastic because we were calling to talk about how global partners were using navigation and thinking about sustainability. And what was interesting is that they had started using the Sustain tool and we had adapted. And so it was amazing to say like, oh, we're ending the same place. We're thinking about it the same way. So we've definitely sent along the versions that we have, citing WashU, citing our tool, and then just saying, of course, I think Kim, Karen, as people are adapting, what are their lessons learned? What is and isn't working is something that we've asked for as well, especially in the navigation domain, just because I think that it's iterative, the process, as well as the tools. I do think, one of the things we heard from folks is, this is a lot of questions, it's 10 to 12 minutes perhaps, but it feels. So, I mean, even something that's, kind of a quick win in getting like maybe the most priority questions out is something, that you've adapted that we probably will look at in the future as we get ready to move forward. But I would say that one of the thing that I've been interested too, as folks are learning from our opportunity, is sharing back and to make sure that we have really great tools that are informed by others in different settings as well. So I know that question has come up. I think I've been asked that every time we've talked about it. So I just wanted to cut to the chase because I think it's one of the big things. But also, was there any other big questions that we've received in terms about the tool and the adaptation that you want to share?
Yeah, I think a big question people have is, and I talked about this just briefly, is like, if I feel like I'm not informed about one of the questions or domains on there, can I skip those questions? And I would say the advice that we gave the clinic systems is, yes, you can skip those questions if you feel like you don't have any knowledge about it, but sometimes that low level of knowledge can also be helpful for answering. So we encourage clinic systems to respond to the best of their ability, and that can really help spark conversation as well. If there are some people who are like, I want to know more about this as we're sparking these conversations.
Excellent.
And I'd be curious if any people on the call today have used these tools for their other programs as well.
And it's a Monday. Everybody has the weekend fog. I should say I do. If you have any other thoughts, questions, I think as Elsa said, any other folks that have used or even from CCSP been a part of this, anything you want to share, we'd love any comments. While we're queuing that up, and again, if you could let us know in the chat if you'd like to, we'll pause for some quiet time for those who might just be on the phone. But Kim, Karen, before we do that, ladies, anything else, I guess, the common questions you receive that you'd love the group to know as well?
Karen, I don't know if you had anything that you wanted to share, but I would say I did appreciate, Elsa's question about what if I can't answer, and the response that you gave, Elsa, is exactly the way that we instruct folks as well. Answer as best you can, and if you really can't, that's what the NA is there for.
It's funny, that was what came to mind as well. Like, that's a question I feel like Kim and I get every time we work with the group. There's always somebody in the group that is like, but you tell us to invite these stakeholders and getting different perspectives from our stakeholders, which means sometimes there are stakeholders who may not know everything. So we get that question a lot.
Great. And it looks like we have a question from Betsy and then one from Katie. So Betsy's saying she's curious of the adaptations you're seeing with CCSP to the tool are similar to those you've made with other programs. And if there's anything kind of a lesson learned or what has it told us about sustainability? So Kim, Karen, I think for the groups you mentioned, anything you want to share?
So really for the adaptations that we are making, they're very specific to either the program or the group that we're working with. And so we haven't come across anything that is like very similar in the changes that we're making. I think if that was the case, then it would sort of tell us something about the, changing the original tools possibly to make them more universal. But I think what we're really seeing is just small changes that make them more useful for either the program or the group that wants to use them.
Mm-hmm. And Kim, I know one of the things we worried about is that if we tailored things too much, would it deviate from what you learned in your process around these specific, domains, and what does that look like? I know we worked with you guys to, once we received feedback from people, then came back to the well of knowledge, you and Karen, to say, this is what we're learning. Are we still within kind of the fidelity of what the model looks like? And I guess what kind of latitude do you think that we have in terms of changing it too much that it's completely askew, or is that something groups should even worry about?
I think, the reliability and validity testing that we have done is for the specific tools that we developed. And I think, you can do that with the adaptations as well. Like you can use the data that you have and we can look at that also. But I think for the most part, the changes that you all made weren't like huge sweeping changes. They were, again, like to make it a better fit for the work that you were doing. And so I don't think that you have to have any concerns about the deviations that you made. But and in fact, like none of the groups I've worked with have made that big of changes to the original tools. So I haven't really worked with anyone that we've had some big concerns about, like, is this going to work, or is this still like supporting their program? Because those same ideas are still there, the same supports, the same sort of domains that kind of we think about when we think about sustainability.
Okay, great. And I see Katie has a note here that they've used at the Rural Health Center for both their QI and chronic disease programs. And I know within Colorado have adapted. Kim, Karen, do you feel that in general, if people are using the tool, like getting in touch with you, or do you think there's a lot of groups that just adapt and use on their own? I mean, I know that we've asked and we worked together for some of the technical assistance, but do you advise groups get in touch with you if they're interested in adapting the tool, or what recommendation would you give folks?
That's a really good question. And I think, I think it depends on the work that you're doing and also the resources and sort of the capacity that you have. So if folks that you're working with have a good understanding and have like thought about it, then, great. Like I said, it's a free tool. So you are welcome to change it into a way that it works for you. But that is something that we're here for as well. So if you are looking for some feedback or even just sort of knowledge exchange about the tool the changes that you want to make or how we developed our tools, like we're here for that. We're here to help. And I would say we get emailed regularly with through the website with folks that ask questions about being able to use it or being able to make small changes to it and things like that. So it is something that we see pretty often, but my hunch is because it is out there, people can are doing whatever they want to with it as well.
Mm-hmm. Great. And I see Betsy's comment that I think your earlier note that, the sustainability planning is still really dependent on groups and where they're at, and even for those individual orgs. So thinking that coming through, but I would also say that definitely as we get ready to share what we've learned from CCSP in January, there's definitely some themes that came forward. and the individual plans were there, but then in terms of, again, where we saw some rising up, it's very interesting from a programmatic level to think about direction too. So I think that rounds us out. Elsa has put in a registration for part 2. We'd love for you all to join us. Tell all your friends who are interested in this sort of D&I/evaluation/sustainability planning to join us. There's also an evaluation link. If you can give us some heads up about what worked today and how this was helpful. And I want to thank, anybody who was on the line today who was very much involved in this work. I know Nicole Hardy and Kristen Legreese are not here. Shannon Prey, that they were very engaged in the development of this tool and the work with us in those case studies. And then several of you, Betsy, I think there's a couple other phone members who helped in the development of the toolkit, which was a labor of love. So I just want to say that we're going to continue this on. We are going to talk about the first phase of what we learned through the sustainability planning approach, as well as what we've learned in further assessment through CCSP and the directions that we're going. So it's now, again, the top of the hour. Kim, Karen, thank you a million for all of the time and effort. And it's been a pleasure, and we've continued this relationship moving forward. So thanks, ladies, for joining us, and Elsa for all of the great work that you've put in terms of really developing and implementing.
Yeah, thanks so much for letting us join today, Andy, and thanks everybody for coming to listen.
Great. Thanks, Monica, for the shout out. And Erin, any last minute, any big P and TC things that are happening in the next couple of weeks or first of the year you want to announce?
Let's see. I will definitely get with Elsa because I know she has you all on the listserv, but we always have trainings coming up and for 2022, and we'd love for you to join in. So yeah. Thanks,
right.
Andy. Off the top of my head, we have our standard level 1 care coordination coming up and motivational interviewing opportunities. So
great.
We will definitely share out. Thank you.
Okay, great. And PNTC will continue to provide info. We'll continue to provide info. And any of our national partners who are new to the effort, we'll try to keep this registration list so that we can disseminate info out. So, all right, everybody, have a great rest of the day. Happy holidays, and we'll be back in January. Thanks so much.
Bye.
Thank you all.